Personality disorders are characterized by enduring patterns of behavior, cognition, and inner experience that deviate markedly from the expectations of the individual's culture. These patterns are inflexible, pervasive across a wide range of personal and social situations, and lead to significant distress or impairment in social, occupational, or other important areas of functioning. The DSM-5 classifies personality disorders into 3 clusters: A, B, and C. Here's a brief overview of all 10 personality disorders. Cluster A, odd or eccentric disorders. This cluster is characterized by odd, eccentric thinking or behavior and contains 3 personality disorders. Bear in mind, though the symptoms of this cluster may resemble some of the symptoms of schizophrenia, they do not involve psychosis, which is necessary for the diagnosis of schizophrenia. 1. Paranoid personality disorder. Individuals with this disorder are often excessively distrustful and suspicious of others without sufficient basis. They may believe others are deceiving them, use them, or harm them, even without any evidence. 2. Schizoid personality disorder. This personality disorder is characterized by a lack of interest in social relationships, a tendency towards a solitary lifestyle, emotional coldness, and apathy. People with this disorder often struggle to form personal attachments or express their feelings. 3. Schizotypal personality disorder. Individuals with this personality disorder exhibit odd behaviors and thoughts that would typically be perceived as eccentric, odd, or peculiar. They may have unusual beliefs or magical thinking and have difficulty forming relationships. Cluster B, dramatic, emotional, or erratic disorders. Disorders in this cluster are characterized by dramatic, overly emotional, or unpredictable thinking or behavior and interactions with others. This cluster contains 4 disorders. 1. Antisocial personality disorder. This disorder is marked by a long-term pattern of disregard for or violation of the rights of others. Lack of empathy, deceitfulness, and manipulativeness are common. Individuals often have a history of legal problems, impulsive and aggressive behavior. 2. Borderline personality disorder. Characterized by instability in interpersonal relationships, self-image, and emotions, as well as marked impulsivity. Individuals may experience intense episodes of anger, depression, and anxiety that may last from a few hours to days. 3. Histrionic personality disorder. Individuals with this disorder exhibit excessive emotionality and attention-seeking behavior. They may be uncomfortable in situations where they are not the center of attention, and their behavior may be often perceived as dramatic, enthusiastic, and overly flirtatious. 4. Narcissistic personality disorder, marked by a pattern of grandiosity, need for admiration, and a lack of empathy. Individuals with this disorder often have an inflated sense of self-importance and a deep need for excessive attention and admiration. Cluster C, anxious or fearful disorders. This cluster includes disorders characterized by anxious, fearful thinking or behavior. It contains 3 personality disorders. 1. Avoidant personality disorder, characterized by social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Individuals often avoid social interaction for fear of being criticized or rejected. 2. Dependent personality disorder. This disorder is defined by a pervasive and excessive need to be taken care of, leading to submissive and clinging behavior and fears of separation. Individuals often have difficulty making decisions without an excessive amount of advice and reassurance from others. 3. Obsessive-compulsive personality disorder, not to be confused with obsessive-compulsive disorder, OCD. This disorder is characterized by a preoccupation with orderliness, perfectionism, and control, at the expense of flexibility, openness, and efficiency. People with this disorder may be overly devoted to work and productivity, and they may be rigid and stubborn. Thanks for tuning into our video. If you're eager to dive deeper into the realms of psychology through narrated content, covering topics from personality distinctions to mental disorders and fascinating historical cases, don't forget to subscribe. Stay connected for more insightful content. Appreciate your support and catch you in the next video. Goodbye.